Great. Thanks, Liza. It's really exciting to have Jason here, and I have to admit that we come from a very multi-professional, interprofessional family, as I'm sure many of you guys do. So when we get together as a family, you know, it's dentists and physical therapists, dietitians. And there's always Jason, who I know is involved in healthcare, but don't be offended, I'm never exactly sure what it is that he does. So will you tell us, Jason, what is it that you do as the Chief Experience and Talent Officer at INTEGRIS?
Sure, thanks. So first of all, I'm a recovering attorney, don't blame me. And so I started in that area and work in human resources within the organization. And it was about 3 years ago that they said we really need to put a system-wide focus around the consumer experience. So INTEGRIS is the largest healthcare provider in the state, 10,000 employees, 10 hospitals across the state, 500 physicians, large rural or small rural hospitals to our flagship hospital, which is a top 5% acuity CMI hospital in the nation, multi-organ transplants, all of that stuff. But how do we get to where we have some level of common experience around for our patients across that perspective? And they asked me to stand up that team to begin the conversation as a system about what does that look like. And we felt very much that it was rooted in culture. So the experience from a human resource perspective blended very well with the experience from a consumer perspective. And part of the thinking then, I think, is also true here, as I've enjoyed the conversation thus far today. Much of it is about context and perspective and breaking down barriers and the lens through which we are seeing events and the lens through which we are interacting, right? And so part of the human resources component blends very naturally with the consumer experience perspective, because if you can break down that lens, you can actually then have cross-fertilization of culture, and that's the goal.
So from what I get from you, you're responsible for working towards reducing stress and burnout in your providers, but yet also being responsible for this consumer or this patient experience. Mm-hmm. I have to imagine that that places an immense amount of stress on leadership.
Right.
So what is your organization doing to take care of its leaders?
Right.
I mean...
Well, it's interesting. So first of all, congratulations to the committee, who have obviously hit upon a topic that is cross-disciplinary, across the country, and even across the Atlantic, as we have friends from Africa and the UK. And I teach a class at INTEGRIS on leading change, and it's based on the Kubler-Ross model. And so for me, as I was sitting back, I had an epiphany that we talk very much about departments going through change and the stress that creates, and then the facilities going through change and systems going through change. I think this is evidence that healthcare is going through change, and I'm thinking we're probably somewhere between denial and bargaining and depression on the model, and yet to really make the rounds up through acceptance. And I quite honestly, part of the epiphany was, I think part of this well-being conversation is that stages of change with respect to everything that's being forced on healthcare right now. And our goal is to get us from point A to acceptance as quickly as possible. So we have identified that well-being of providers, and providers is global, not just physicians, but all the clinicians that actually touch the patients, has a strong impact on the overall consumer experience. And one of the challenges that we saw is different disciplines trying to focus on different aspects of their practice and their component and the different levels of stress and burnout and things that they were facing. So we began a conversation around, and this is a design thinking piece. We began the design thinking conversation a couple years ago as an organization, but it's about what are you designing, right? That's the key component. And the idea around design thinking we heard this morning is that it puts the human in the center, right? Well, which human are you putting in the center? Is part of the thinking as well in how you go about designing your thought process and the processes in addressing an issue. So one of the things that I've taken to talk about, because Katie's right, I work in healthcare, I'm surrounded by healthcare in my family, but I am not of healthcare. So in many ways, I don't have a dog in the fight, when we get into these conversations is I talk about the iPhone, right? So we try to form, and one of the things we've done is form a cross-disciplinary team from across the system, so not just the hospitals in different areas, to come together to have this conversation about well-being. But in one of the very first conversations, we talk about every one of them individually was focusing on being the very best and meeting the needs of their constituencies so much, just like the days before 2007, there were a group of people making the very best camera there possibly was, and someone was making the very best phone there was, and someone was making the very best calculator there was, and someone was making the very best way to communicate by email there was. And Steve Jobs came and said, no, what you really want to be making is this, right? Which is all of those in one. And that's a conversation that I've been trying to lead with our organization, is to get beyond focusing on creating the best of whatever we're intended to create, but to create the best system that will support the patient at the center. And in doing so, how do we go about then transitioning that into over broader care, right? The next conversation that I think is important that we're trying to have is a conversation about leadership, and trying to define leadership as it relates to every single individual. And one of the things that I've tried to do is when we talk about the consumer experience and trying to talk about, all right, how does that play into well-being, and how does well-being drive some of that? I get pushback, and I understand there's probably a number of physicians in the room, but I often get pushback from physicians around one component of it. We talk about, and I hear this also from nurses and others, we bring up customer experience, and the first thing they think of is happiness. We got to make happy patients, right? You know, we got to make happy patients. And so we began the conversation talking about, the food service industry. And what I hear from the clinicians back to me is, we're not serving hamburgers, we're saving lives, right? People's lives are at risk. And so then we talk about the hotel and hospitality. We're not a hotel, people's lives are at risk. So we began talking about the airline industry, right? Everybody flew here, many people flew here, but believe it or not, when you were on the plane, your life was at risk. And so I have the conversation with clinicians around, when you got off the plane the last flight, did you turn to the pilot and say, thank you for saving my life? Because that's exactly what they did. And the conversation is rooted in consumerism. People are now going to be choosing who they see and what they like based off of their experience, right? And no longer saving someone's life, that's what they pay you for. And that's part of the change that is really, really difficult for certain providers to understand, is that we're moving beyond that situation where my skills and my training and my competency is the reason by which I will have patients continually there. But the reality is that's what they pay you for. And they're going to come to you, and their experience is based off of what happened during that journey. So we always try to use the experience of the pilot is the doctor, who really has a lot of responsibility to get patient from point A to point B, but also to support everyone along the way through that journey as well. So we collaborate. We're part of the Mayo Clinical Care Network, and Mayo has established a physician well-being collaborative, and we were one of their pilot programs around that, and are focusing on physician mentoring. We have physician compass groups that we use to support providers that bring people together in social settings. We've sent providers to Navant Healthcare's leadership program that they do a 3-day piece, because the focus is on the individual. We believe firmly that the individual provider is the one that ultimately long-term is going to be the one that changes their overall well-being from that perspective.
So, thank you. So, let's be real.
Right?
You're a leader. You talked a lot about what you're doing for your providers, but at that leadership level, how do you make it from the day to day? And this is going to be our question that we make it interactive and we turn it on you so you can be kind of thinking. How do you take care of yourself?
Right.
And how do you show that and model that for these people that you're trying to, quote, make happy?
Right. So I'm over our wellness program also. And one of our presidents of one of our hospitals lived in my neighborhood and was walking And as she walks by my house, I'm sitting out front, she walks by me and she says, "Wellness program." And I raise my beer to her and I say, "Wellness program." The reality is, it's a little bit for everybody. You have to be aware. Self-awareness is the #1 core course that we make every executive go through at INTEGRIS, because self-awareness is it's a foundation for everything. The reality of whether you're good at it, perfect at it or not, at least you're aware of where you are in that process. But it's also finding something that meets your passion outside of work. We heard earlier about 120 hours a week. We heard all these different conversations about different things, but what meets your passion outside of work? And when Katie mentioned she was going to ask me this question, I told some people at work and they said, "No, you cannot say that. You're from Oklahoma. You cannot say that." Because one of the things that I have established is we bought land recently, and we now have 12 acres, and I go out and we have 2 horses, and I've got goats, and I have chickens, and before this, everyone would look at me and say, "That was not you. That has nothing to do with me. Law school in Virginia, all these different things. What are you doing with this?" And I spend my days fixing fences and chainsawing the trees and feeding the goats, and that is what is going to extend my work life. Every day I get to go home, and friends of mine who grew up as farmers are like, "God, that's just work." And I'm like, "No, this is awesome," because it's a relief, and it is something for me that feeds my soul that I have found. My boss before me built a pickup truck out of nothing, right? That was his passion. Katie owns an RV.
My husband owns an RV.
All right, so... And so that is something that they do that's new in their lives, but it's something that they've added as a way to get from point A to point B, because you have to find a way to de-stress. We did a survey of all of our employees last year, and we asked resiliency questions in our employee engagement survey. And there were 2 components, activation and decompression. Activation is, at my work, am I happy in my work, what I do day to day? And we did really well on that. People are passionate. Our values are love, learn, and lead as an organization. People get the passion. Decompression is, am I able to check out when I'm done? We failed at decompression because even we thought maybe at least the hourly staff could, when they clock it out, they could go. No, because they were getting calls that night to come back and take a different shift. And decompression is where we failed as an organization, and it's where we as leaders need to start to model the way of how do you get to decompression.
Great. And I think we don't have enough time to be interactive, so I think maybe my challenge for you today and tonight and tomorrow is to have those conversations with each other about what it is you do to decompress, because I think sometimes even just those interactions with each other about goats or the things that when you leave that job that help you be that happier person. So any final thoughts or observations, Jason, from the things that we've been talking about here? I know you'll be back up for the panel, but we've really appreciated hearing from that perspective at that leadership level. So
yeah, the final thought I would have is to continue to break down those barriers and continue to put the patient at the center, because too often we as healthcare have built models that in some ways don't always consider what's best for the patients. And we're moving towards that, but we're being forced to that in some ways through the consumerism and that drive. And we just have to get to the place where we recognize that, but to do so in an environment where we build each other up and support each other along that journey as well. And the final thought would be that self-care is #1 in my opinion, right? And it is #1 because a leader cannot expect nor provide a safe environment for their teams unless they're at a place where they're at least aware of themselves and at least making steps towards that. Not perfection, but steps towards that. Then you build a department like that, then you build a facility like that, and soon you have a system that's built like that as well.
great, thank you.
Thank you very much, Katie and Jason.